Understanding osteosarcoma. Causes, signs, symptoms, and treatment. Osteosarcoma is the most common type of primary bone cancer, predominantly affecting children, adolescents, and young adults. It usually occurs in the long bones, such as the femur, thigh bone, tibia, shin bone, and humerus, upper arm bone, often near the growth plates where bone growth is rapid. Here's a comprehensive overview. Causes. 1. Genetic factors. Gene mutations. Osteosarcoma is associated with mutations in certain genes, such as the RB1 gene, linked to retinoblastoma, and the TP53 gene, involved in Li-Fraumeni syndrome. Inherited syndromes. Genetic conditions like Li-Fraumeni syndrome, hereditary retinoblastoma, and Rothman-Thompson syndrome increase the risk. 2. Rapid bone growth. Adolescence. The rapid bone growth during puberty is a contributing factor, making this age group particularly susceptible. 3. Previous radiation therapy. Radiation exposure. Previous exposure to high-dose radiation therapy for other cancers can increase the risk of developing osteosarcoma in the irradiated area. 4. Paget's disease. Bone disorder. This chronic disorder, which leads to abnormal bone destruction and regrowth, can increase the risk of osteosarcoma in older adults. Signs and symptoms. 1. Pain. Persistent bone pain is the most common symptom, often worsening at night or with activity. 2. Swelling. Swelling or a noticeable lump may develop in the affected area. 3. Limited range of motion. Pain and swelling can restrict movement in the affected limb. 4. Fractures. The bone may become weakened and prone to fractures with minimal trauma. 5. Localized tenderness. The affected area might be tender to touch. 6. General symptoms. Less common but may include fever, weight loss, or fatigue, especially in advanced stages. Diagnosis. 1. Physical examination. Initial assessment of pain, swelling, and functional limitations. 2. Imaging tests. X-rays. Initial imaging to detect bone abnormalities. MRI. Detailed imaging of the tumor and surrounding soft tissues. CT scan. Useful for assessing lung metastasis. Bone scan. To detect other areas of bone involvement. PET scan. To evaluate the metabolic activity of the tumor. 3. Biopsy. A sample of the tumor is taken and analyzed to confirm the diagnosis and determine the tumor's grade. 4. Blood tests. May include alkaline phosphatase and lactate dehydrogenase levels, which can be elevated in osteosarcoma. Treatment. 1. Surgery. Limb-sparing surgery. The goal is to remove the tumor while preserving the limb. This may involve bone grafts or prosthetic implants. Amputation. Necessary in some cases where limb-sparing surgery is not feasible or if the tumor involves critical structures. Rotationplasty. A procedure that involves removing the cancerous portion of the limb and rotating the remaining limb to improve function. 2. Chemotherapy. Neoadjuvant chemotherapy. Given before surgery to shrink the tumor. Adjuvant chemotherapy. Given after surgery to eliminate remaining cancer cells and reduce the risk of recurrence. Common drugs include methotrexate, doxorubicin, cisplatin, and ifosfamide. 3. Radiation therapy. Limited use. Generally less effective for osteosarcoma but may be used in cases where surgery is not possible or to control pain. 4. Targeted therapy. Emerging treatments. Research is ongoing into targeted therapies that focus on specific genetic or molecular aspects of osteosarcoma. Prognosis. Depends on factors. Prognosis depends on factors such as the size and location of the tumor, the extent of metastasis, and the patient's response to treatment. Survival rates. Overall survival rates have improved significantly with advances in chemotherapy and surgical techniques, particularly for localized disease. Follow-up care. 1. Regular monitoring. Ongoing follow-up to monitor for recurrence or metastasis, typically involving regular imaging and clinical assessments. 2. Rehabilitation. Physical therapy to restore function and mobility, especially after surgery. 3. Psychosocial support. Counseling and support services to address the emotional and psychological impact of the disease and treatment.